Hey chiropractors, Dr. Charlie here with ProCredits. Instrument-assisted soft tissue mobilization is a great technique to help reduce pain, release fascia, and improve range of motion and functioning, and just makes your chiropractic treatment that much better. ProCredits offers 4 easy-to-learn modules on instrument-assisted soft tissue mobilization at ProCreditsCE.com. Here's an excerpt from some of those modules. Enjoy.
When handling the tool, it's important to hold it at a 30 to 80 degree angle from the treatment surface. We will assess treatment at a lower angle because it's much more comfortable for the patient, but treat at a steeper angle. Remember, the steeper the angle, the deeper the treatment. The IASTM treatment protocols utilize many different types of strokes. Each of these strokes is as important as the next. Determining what type of stroke to use will be according to the size of the area that we're treating, as well as the type of injury that we will be treating. Some strokes will be used for assessment and treatment, while other strokes will be for treatment only. Assessment and treatment strokes will be the sweep, the fan, and the brush, while treatment only will be the dig, the frame, the strum, the J-stroke, and the fillet. We will now go over each type of treatment stroke. Before treatment begins, we must apply emollient to the skin. Please note that you can use the tool to apply the emollient only if the tool has been properly cleaned. Once the tool hits the skin, it cannot be put down back into the emollient jar. Apply enough emollient to allow the tool to glide, however, not too much where no traction can be obtained. A desensitization stroke is used to bombard cutaneous receptors to help decrease pain in situations where a patient is very sensitive or acute. A very light stroke should be used and gradual pressure can be applied per the patient's tolerance. This is also a very good way to initiate treatment. It will prepare the area for a more deeper aggressive stroke. Various tools can be used, but the key is to use light force. A desensitizing stroke is used to bombard cutaneous receptors to help to decrease pain in situations where a patient is very sensitive or acute. It's a very light stroke which gradually increases in pressure as per patient's tolerance. It's a good way to initiate treatment, and various tools can be used, but the key is to use a light force. Before we begin our assessment strokes, it's important to warm up the tissue with either movement or a heating pad. We begin with light strokes, then use more force to engage deeper layers. Areas that have the greatest tissue irregularities, i.e. the tool vibrates the most or more effort is needed to move through the tissue, should be targeted for treatment. Note, irregularities do not necessarily indicate pathology. Different tissues have different textures. For example, the IT band is much more fibrous than the wrist extenders. We must combine our tool assessment with the big picture of our patient's subjective and objective evaluation. Remember, assessment strokes can be used with a variety of different types of tools, and they are either sweeping strokes, fanning strokes, or brushing strokes, as you will see in the upcoming slides. Sweeping strokes are strokes made in overlapping motions parallel to the target tissue's fiber orientation. They may be short or long with a one-handed or two-handed grip on the tool. These strokes are good for treating broad regions such as quadriceps, lumbar and thoracic regions, or hamstrings. And the sweeping stroke is usually performed with a larger treatment edge for more comfort. These strokes are used for both assessment and treatment of the area. Sweeping strokes are strokes made in overlapping motions parallel to the target tissue's fiber orientation. They may go in either direction, and they may be short or long with a one-handed or two-handed grip. They're usually performed with a larger treatment edge for more comfort, and they can be used for both assessment and treatment. You can use the convex part of the tool, the concave part of the tool, or even a large tool known as a handlebar tool, as long as the bevel is facing upward. Fanning strokes are strokes in an arc of motion pivoting around a somewhat stationary point while the treatment edge fans in a semicircular motion. They are usually performed with a larger treatment edge for more comfort. Fanning strokes are used for both assessment and treatment. A fanning stroke are strokes in an arc of motion pivoting around a somewhat stationary point while the treatment edge fans in a semicircular motion. Once again, these usually go with the fiber orientation of the muscle, but can go in either direction. Again, these are used for both assessment and treatment. Brushing strokes are short strokes of similar length parallel to the target tissue's fiber orientation. They are very similar to sweeping strokes, except brushing strokes are much shorter in length. They're usually performed with a smaller treatment edge, like the one depicted in the red circle, and they can be used for both assessment and treatment of the tissue. Brushing strokes are short strokes of similar length parallel to the target tissue's fiber orientation. They're usually performed with a smaller treatment edge because they're usually performed in smaller areas. Again, they can be used for both assessment and treatment. Once areas of adhesions are found through our assessment strokes, digging strokes can now be used to treat the structures. Digging strokes are performed by using a scooping motion into the tissue being treated multiple times. They are usually performed with a smaller treatment edge. But remember, digging strokes can be only used for treatment. Once areas of adhesions are found through assessment strokes, digging strokes can be used to treat the structures. These are performed using a scooping motion into the tissue being treated multiple times. Because of the great angle that's used to hold the tool, these treatments are used to get into very deep parts of the tissue. They're usually performed with a smaller treatment edge and remember can only be used for treatment. Framing strokes are short to medium strokes used around superficial bony contours to mobilize the soft tissue around these structures. These structures include the scapula, the acromion, the lateral epicondyle, ulnar, styloid, patella, malleoli, and more. We will start from the center of the bony structure and work our way out onto the soft tissue connections. They're usually performed with a smaller treatment edge and can be used for treatment only. Framing strokes are short to medium strokes used around a superficial bony contour to mobilize the soft tissues around these structures. These can be used around the scapula, acromion, lateral epicondyle, ulnar styloid, patella, or malleoli, for example. They're usually performed with a smaller treatment edge and again can be used for treatment only. Strumming strokes are short strokes of similar length that are perpendicular to the target tissue's fiber orientation, very similar to a cross-friction massage. Strumming strokes are in the exact opposite direction as the brush strokes, which were parallel to the target tissue's fiber orientation. With strumming strokes, we always move in one direction, utilizing the bevel edge, and then switch to the opposite direction. They are usually performed with a smaller treatment edge, as depicted by the red circle, and strumming strokes can be used for treatment only. Strumming strokes are short strokes of similar length applied perpendicular to the target tissue's fiber orientation. Always move in one direction using the beveled edge and then switch to the other direction. This is very similar to cross-friction massage and are therefore very good at breaking up adhesions. A J-stroke is a strumming or brush stroke with a hook motion added to the end of the stroke path. It may be used when following the contour of certain types of tissues. It's usually performed with a smaller treatment edge and can only be used for treatment. A J-stroke is a strumming or brush stroke with a hook motion added at the end of the stroke path. It initially starts out parallel with the fiber orientation and ends perpendicular. It is usually done with a small treatment edge and can be used for treatment only. Some advanced treatment concepts may be adding patient movement to the IASTM treatment, which often will enhance our treatment outcomes. The primary objective is to facilitate gliding between tissue planes or structures that have become adherent or dysfunctional. Most of the basic treatment strokes above work well with movement added. The key is to determine through test, treat, reassess practice principles which combinations and which direction with the movement of the muscle or contrary to the motion of the muscle gives the best results. The tissue plane is important for this type of treatment. A good starting point is holding the tool 90 degrees to the treatment surface, which facilitates tissue separation between muscle bellies, nerves and nerve beds, or tendon and tendon beds. The tool motions are rocking, scooping, or swiveling, depending on the anatomy and the intended effect. You could also add a pin-in stretch, where as the patient actively moves the target area, you add a sweep, brush, or fanning stroke. This can be performed in the direction of or against the patient's movement. Anterior knee anatomy consists of the quadriceps muscle, which is the vastus lateralis, the rectus femoris, and the vastus medialis, as well as the quadriceps tendon, which is located superior to the patella, and the patella tendon, which is located inferior to the patella. The IT band on the lateral aspect of the leg consists of many fibrotic adhesions that need to be treated, as well as the area where the IT band attaches and interdigitates with the lateral collateral ligament of the knee. We'll look at the pes anserine area, which is on the medial side of the knee, which is where the sartorius, the gracilis, and the semitendinosus muscles all come together and attach. This is a very sensitive area even when it's not inflamed, so treatment to the pes anserine area should be very light and not too deep. The anterior muscles associated with knee pathology will include the quadriceps first, and what we can do is a simple sweep along the quadriceps. Remember, there's three muscles here. We have our vastus lateralis, our rectus femoris, and our vastus medialis. So we really can take a larger edged tool to hit these muscles, and we'll just do a sweeping motion. If we find any irregularities, we can stop and treat them. We could change our tool, and we could strum across the muscle fibers as well. When we get down towards the knee, we could treat the quadriceps tendon, which attaches just to the superior part of the patella. We could work that tendon superior and inferior, and we could also strum across the tendon as well. Below the knee, we have the patella tendon, and once again, we could treat that the same way. We can go with the fiber, and we can strum across the fiber as well. We could also frame the knee. So anytime we frame a bony substance, we go from the inside of the bony structure and just work our way out in a star pattern, and we're just hitting any kind of soft tissue that is connecting to that bony structure. In this case, it is the patella. So this is framing the patella. We could also use our J stroke to work our way along the lateral aspect of the vastus lateralis, and then J stroke down into the IT band. And then finally, we could also treat the IT band going from superior to inferior. Finding any irregularities, we can stop and treat those irregularities. We could strum across them as well. But remember, the IT band is very fibrous, so you will get some irregularities in that area. And then where it connects to the lateral collateral ligament of the knee, we could treat that area as well.